Well, none of us can actually turn back the clock, but looking younger is possible. You don't even need surgery.
There's a procedure that's natural and takes just 30 minutes. It could address some of the most common concerns like wrinkles and even sagging.
Yeah, from Restorative Health, Chief Medical Officer, Dr. Melissa Loseke. Good to see you, Doctor.
Nice
Thanks
to
for
see
stopping
you.
by.
Good morning, guys. Wonderful to be here.
Yeah, we're talking about this vampire facelift, right? So exactly what is this?
So this is just kind of about looking younger, looking about the best you that you know there is. It's a procedure in which we take PRP, platelet-rich plasma, which is honestly all the rage, so hot right now. And what we do in that is we take your blood, spin it down, and concentrate out those platelets. Platelets are responsible for growth and healing, and then we inject that tissue into the face in the facelift.
And it produces what kind of results?
So the results are amazing. Young or old, it doesn't necessarily matter. Everybody will see some results. And when we inject it into the face, you can see new collagen growth to make a younger, more youthful look in the face.
And we have a before and after here. Who's this?
This is Dixie Hale. She is an employee of ours, and Dixie had her facelift done about 2 years ago.
Does she still look then on the right the way she did initially, like when she first had it done?
Yes, Dixie probably actually looks better, and that's the beauty of PRP. If you inject it into a joint and we do MRIs, we know that it's active for about 18 months out.
Wow.
Oh, wow.
It's active for that length of time.
It's active for that length of time.
But she looks, what you were saying a moment ago is you look like yourself. She doesn't look like she had work done, which I think a lot of people, that might be why they don't pursue some of these options, because they still want to look natural.
Absolutely. In-office procedure, you're back out within 30 to 45 minutes, and there's no restrictions. If as a woman, if you want to go put makeup on, go have dinner with your husband, absolutely.
Wow. Well, women and men.
Women
who are good
and
candidates?
men.
Who are good candidates for the vampire facelift?
Young or old, it really doesn't matter. Everybody is going to see some results. Like you said, men, women. We're seeing a trend to a lot younger women, and I think it's that as a busy mom, a busy executive, you look in the mirror and you're like, gosh, when did I start looking so tired? Who is this girl? I know she's in there. And it lets you bring out that person that you know is inside there.
What are some of the main benefits? It sounds like they're numerous. What are some of the key benefits of the vampire facelift compared to a conventional facelift?
No downtime is probably the biggest. An in-office procedure that has no risks because I'm using your own blood. You're going to get that new collagen growth, whereas in a conventional facelift, you're just cutting and lifting and tucking. You're going to get new blood vessel formation, which is going to retone and retexturize that skin surface. A lot of women will tell me, I don't need makeup like I used to. My skin tone itself just looks better.
Yeah. Let's talk about something. This is not for guys, right? It's called the O-Shot. We talk about all kinds of things on the Morning Blend, by the way. The O-Shot, it's for women. Explain what this is.
So this is, again, taking PRP and injecting it into women for reasons such as sexual dysfunction, incontinence, and just for more sensation as well.
And it's the same idea. So again,
Same
it's
idea.
natural.
Same idea. It's natural. An in-office procedure. The statistics out there say that 1 in 20-year-olds have issues with urinary incontinence.
Wow. So you're not talking about women who are like postmenopausal.
Right.
I'm talking
and
about
not new mothers either, not just new mothers.
New mothers are great. A lot of women who've had vaginal deliveries will notice urinary incontinence is an issue, and you start avoiding things that you want to do. Or if during delivery they've had some tearing and some discomfort in relations with their spouse now, it can help fix that as well. So you can get back to enjoying that one-on-one time with your spouse.
What are women saying about it? The response, what have you heard?
Overwhelming. Overwhelming. I just talked to a gal, I got back from Atlanta, who had it, who said, I can't remember the last time I didn't have painful intercourse with my husband. For the first time in years, no pain with intercourse with her husband.
Wow.
Okay, what's the best way? The best way to kick off the process of learning more about the O-Shot and stopping in for a consult?
2 best ways. Go to our website. There's tons of information on our website, restorative-health.com. And just that, pick up the phone, give us a call. We have free consultations, and everyone in our office has either had procedures done themselves or are very adept at the knowledge behind it.
And here is a look at the website. So you see it, you see Dixie's picture on the homepage. If you'd like to read more, because I feel like for a lot of people, maybe they've heard about it because there have been some major celebrities that have elevated, I don't want to draw too many names, but they've really put the vampire facelift in the spotlight, but our viewers might not know much about it beyond just the name. And so I think your website is a great place to learn more about that.
Absolutely.
But it is free, isn't it, to come in and get a consultation?
All consultations are free. There is a male version of the O-Shot called the Priapus shot, which is super fantastic because your chronic diabetics, high blood pressure, high cholesterol, who thought there weren't any options, now there's an option.
What has the response been from men that have had that procedure?
Again, very similar to the women. The success rate is 90%.
Wow.
I mean,
High.
I
Extremely
challenge, you know, where can you find a 90% success rate in an in-office procedure?
Yeah.
Well, and I think for a lot of, because it is, like, it's specific to the patient to just go in and not to say, I think I need this procedure, but to go in and say, these are my concerns.
Right.
What are my options? And then
Absolutely.
let you as the doctor say, well, let's talk about this. I
Exactly.
think this could make a difference.
Exactly.
So the number to call for your free consultation, it's 402-205-2006, and then the website, it's restorative-health.com. And I think it's neat that in Omaha you could walk in and see Dixie, the person who is the before and after, and you get to see the results
Yeah.
firsthand.
But there's no harm in getting that first consultation to talk to somebody, no expense either.
Absolutely not. And, you know, it takes some time to decide if this is right for you, as well as a consultation with a medical provider is always an option as well to talk about those options.
Thank you, Dr. Loseke.
Thanks, doctor.
Thank
Yeah,
you,
good to see
guys.
you.
See
Thank
you.
you.
Well, you want to